Hi class, this PowerPoint is on Vaccination and the Immune System by Tamara and Ernesto. In our presentation, we'll be discussing how vaccines have been one of the most widely used tools in modern medicine, credited with preventing disease and saving lives. However, not everyone agrees with their use. In this presentation, we will explain what vaccines are and how they work, look at the adverse effects of vaccines, explore the anti-vaccine viewpoint and reasons why some people choose not to vaccinate, and discuss safety concerns, personal rights, and alternative views on immunity.
So vaccines have saved countless lives and are widely promoted as essential, but there are growing concerns among scientists, parents, and researchers regarding safety, long-term effects, and overuse and necessity. We're going to look at some of the reasons behind these concerns and also talk about the idea of natural immunity as an alternative. What is a vaccine? A vaccine is a medical treatment that helps the body's immune system recognize and fight specific diseases. Basically, it introduces a small, safe amount of a germ, called a pathogen, to the immune system so it can learn to defend against it in the future. Vaccines can be given in a few ways, like through an injection in the arm, an oral dose, or a nasal spray. Once the vaccine enters the body, it exposes the immune system to an antigen, which is the part of the pathogen that triggers the response. This activates immune cells like killer T cells, B cells, and plasma cells, which work together to destroy the foreign substance. During this process, the body also creates memory cells. These cells help the immune system recognize that same germ later on and respond much faster the next time it's exposed. This process is usually safe because the pathogen in a vaccine is weakened, inactivated, or only a small part of the original germ, so it doesn't usually cause the full disease. We'll go more into detail on that later on in the presentation. In a way, it's like giving the immune system controlled practice. However, vaccines aren't perfect and not all bodies react the same way. Some people have concerns about their safety, especially for infants who receive many vaccines early in life. For that reason, some believe vaccination should be a personal choice, weighing the potential benefits against possible side effects.
On the next few slides, we'll be discussing passive immunity, acquired immunity, and natural immunity versus vaccine immunity. Passive immunity happens when a person receives antibodies from another source instead of making them on their own. It offers fast protection, short-term immunity doesn't last as long, and your body does not produce the antibodies they are given to you. Some examples would be natural passive immunity would be a baby receives antibodies from the mother. Before birth would be through the placenta. After birth would be through the breast milk. And artificial passive immunity are antibody treatments given by injection, such as the rabies immunoglobulin or snake bite antivenom. It is used when immediate protection is needed, like after exposure to a dangerous virus or toxin.
Acquired immunity is the protection our body develops after actually being exposed to a disease. For example, when someone has measles or the flu, their immune system learns to recognize the illness and it's able to fight it off in the future. This is why if you had chickenpox once, you usually don't get it again because your body remembers it. Many people who question the vaccine believe that this natural process can create stronger, longer-lasting immunity compared to what's developed through vaccinations.
Natural immunity comes from getting infected and recovering. The body fights off the real virus or bacteria. It often gives strong, long-lasting protection. Some of the risks would be that you have to get sick first, which can be dangerous. An example would be getting and recovering from chickenpox. You then are usually immune for life. Vaccine immunity comes from getting a vaccine, not the full disease. The vaccine teaches the immune system to recognize the virus, usually safer, but you may need booster shots. And getting vaccinated helps to avoid serious illness. An example of that would be that chickenpox vaccine, it protects without having to get sick. You also don't get shingles later on in life, which is from the chickenpox virus. Both types create immunity, but natural immunity involves real illness, while vaccines offer protection without the risk of getting the full disease.
There are several different types of vaccines, and each one works a little differently, but each also raises certain concerns. First, live attenuated vaccines like MMR or varicella use a weakened form of the virus. Some worry that, especially in people with weaker immune systems, these could actually cause mild illness or complications. Inactivated vaccines such as polio or hepatitis A vaccine contain killed virus particles. However, they often include preservatives or adjuvants, which are ingredients meant to boost the immune response. These include like aluminum, which is a very common adjuvant that is used in a lot of vaccines, which some believe could have unwanted side effects. The newer mRNA vaccines, like those used for COVID-19, have raised questions about their long-term effects since this technology is still relatively new. There's not enough data to really back up whether the long-term effects are positive or negative. It's a kind of a risk. And finally, toxoid vaccines, such as those for tetanus or diphtheria, these protect against bacterial toxins, but they require frequent boosters. So this has led to some to question their lasting effectiveness, whether they're reliable or not.
Some of the concerns with getting vaccinated would be the safety and side effects of allergic reactions, fevers, or rare neurological issues, concerns about conditions like myocarditis or Guillain-Barré syndrome, some fear of the links to the autoimmune or developmental disorders, and some also feel that the vaccines were too new or the long-term effects are still being researched.
Aluminum is commonly used in many vaccines as an adjuvant, which helps the body create a stronger immune response. However, aluminum is also recognized as a neurotoxin, and at high levels, it can affect the nervous system. Even though the amount in vaccines is considered small, some people question whether any level of aluminum exposure is truly safe for small developing babies. It's important to note that traces of aluminum are found in many everyday things like baby formula, breast milk, and even our everyday diet. But critics argue that injected aluminum might affect the body differently compared to aluminum we consume naturally.
Some adverse reactions of the COVID-19 mRNA vaccine would be short-term, sore arm, fatigue, fever, headache, chills, usually mild and go away in a few days. Less common but reported were swollen lymph nodes, allergic reactions like rash or itching or swelling. Serious adverse effects, rare but reported, were myocarditis, which is inflammation of the heart, mostly in young males and after the second dose, pericarditis, inflammation around the heart, and anaphylaxis, which is a severe allergic reaction. Others reported irregular menstrual cycles, blood clot risk, and long-term effects are still being studied due to the newness of the vaccine.
Next, we'll be talking about long-term adverse effects. Immunization starting at birth was associated with the decreased risk of insulin-dependent diabetes, while immunization starting after age 2 months was associated with an increased risk of diabetes. The incidence of many other chronic immunological diseases, including asthma, allergies, and immune-mediated cancers, has risen rapidly and may also be linked to immunization. While more studies are still needed, these observations raise important questions about the long-term impact of routine vaccination on the immune system.
Many people believe the vaccine mandates violate their personal rights and have a concern for overforced medical decisions. Many also are concerned with the history of lawsuits and misinformation given by pharmaceutical companies and have fears that profit is placed over public safety. At one point in time, many people lost their jobs due to not wanting to be forced to be vaccinated.
One concern that's often brought up is the issue of waning immunity. Studies on the pertussis or whooping cough vaccine have shown the protection can decrease over time, even after all recommended doses are given. We provided a chart on the right-hand side that shows after 1 year, the effectiveness of the vaccine is about 80%, and it just decreases year by year to about 7, 8, or 9 is down to 10%, and year 10, it's almost not effective at all. If you experience the disease naturally and your body fights it off through your immune system, the effectiveness of immunity lasts about 20 years. So it's almost double the immunity of a vaccine. So this raises the question, if the vaccine protection fades so quickly, could natural infection provide stronger and more lasting protection in the long run? But it's a gamble because you have to get infected first. So
This graph shows reported systemic diseases from the COVID-19 vaccine. You'll see a high number of anemia cases, diabetes, allergies, thyroid, hypertension, etc. These are just some of the long-term effects. The vaccination is still being evaluated. The vaccine is still under review due to its newness.
in conclusion, opposition to vaccines isn't always about rejecting science. For many, it's about choice and caution. A lot of people who question vaccines support natural health approaches and simply want more transparency, better safety testing, and the freedom to make informed decisions for themselves and their families. At the heart of it, this perspective is about the right to ask questions, especially when it comes to something as important as our long-term health.